Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a large number of future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis of our publisher Clinical Hypnotherapy, registered with ISBN. Crisis Techniques in Clinical Hypnosis. Habitation and Salivation, Part 1. Introduction. A crisis is a temporary state of disorder and disorganization in which the patient is totally unable to get out of the situation, using the usual mechanisms and resources for the solution of problems. A crisis is also a particular moment in the patient's life when he or she is confronted with a conflict situation in which he or she is unable to resolve the situation with the usual problem-solving mechanisms and resources that he or she normally uses. Because of a loss of emotional control, the patient is faced with a problem in which his or her adaptive resources, as well as his or her usual defense mechanisms, are not able to solve the problem, as well as their usual defense mechanisms do not work. The problem is beyond the patient's capacity to solve, and as a result, he or she experiences increased stress and anxiety, which further disables him or her from finding a solution. Emotional crises affect us all because they are inherent to our growth and inevitable in a world that is not always welcoming. All of us, without exception, have had or will have conflicts, which will become crises if we do not have sufficient skills and resources to deal with them. Every therapist must have crisis intervention tools. In the case of hypnosis, we have several exercises for crises. These exercises that must be applied in a hypnotic state. They are exercises that will help the patient when he or she is in a state of crisis. Room 25 steps. If there is a classic in hypnosis, it is undoubtedly this exercise. It has been used for so long that it's almost impossible to date it. Its level of effectiveness is unquestionable for all the therapists specialized in hypnosis, and there is no school that does not use it. There are many versions. We expose here 3 of versions: the 25 steps room, the 5 steps room, and the extended room. Steps 51, 51, 51, 51, 51. Rest. We have 2 induction, one on the step and one for the leading. Its level of effectiveness is unquestionable for all the therapists specialized in hypnosis, and there is no school that does not use it. There are many versions. We expose here 3 versions: the 25 steps room, the 5 steps room, and the extended room. And in those versions, we always have a common ground, which is 5 steps, 1 rest, 5 steps, 1 rest, 5 steps, 1 rest, 5 steps, 1 rest, 5 steps, 1 rest. We have 2 inductions, one for the step and one for the landing. With each step down, you will feel more relaxed, more relaxed. We'll never count the steps from 1 to 5 ascending. It will be done in a descending way. We go down one step. You feel more relaxed. We go down another step. You feel more relaxed. We go down another step. You feel even more relaxed. With each landing, you will feel farther away from everything. Everything is too far away to affect you. Everything that is the staircase is an enhancer. At the end of the last landing is the door. It is a door that is closed. Behind that door is your ideal room. Before you open the door, I want you to construct what your ideal room will be like. Color, paint, light, furniture, size, curtains, size, curtains, whatever you want. When we tell you to build your room, we should slow down. Everything that is to the staircase is an enhancer. At the end of the last landing is the door. It is a door that is closed. Behind that door is your ideal room. Before you open the door, I want you to construct what your ideal room will be like. Color, paint, light, furniture, size, curtain, size, curtains, whatever you want. When we tell you to build your room, we should slow down our voice so that you have time to build and decorate your room. Open the door. It's your place to be. Relaxed. It is your favorite place where you stop having problems. Here you are, very comfortable. Nobody else but you. And the people you want to authorize can enter this room. Only you can open the door and enter whoever you want. From now on, and whenever you have a crisis in which you can no longer control your behavior, you will close your eyes and enter your ideal room, where you will immediately feel relaxed, comfortable, and at ease. This is a post-hypnotic exercise. The number of times the patient has entered his room is a marker to indicate the crisis he has had during the week, between sessions. This room exercise is used for dependencies, compulsions, anxiety and neurosis, anxiety and neurosis. It also helps the patient without the therapist being present. The patient resolves their crisis episode without having to phone the therapist for help in the middle of the crisis. If you're interested in learning more about clinical hypnosis, watch our next video, Crisis Techniques in Clinical Hypnosis, Habitation and Salivation, Part 2. Remember to read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. If you have any doubts, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next video. Thank you very much.